Welcome to UT Southwestern's What to Know. Face mask. They were a source of great controversy in our country early in the pandemic, but now we're learning they're one of our best defenses. Joining us today to talk about which masks work best, where we are with vaccines, and the future of the COVID-19 pandemic are Dr. Seth Toomay, our UT Southwestern Health System Chief Medical Officer, and Dr. Brad Cutrell, one of our infectious disease doctors and a COVID-19 expert. Thank you both for joining us. So Dr. Toomay, in the beginning of the pandemic, masks were in very short supply, and many of us were wearing whatever we could find for a mask. Now we have surgical masks, cloth masks, bandanas, gaiters. Tell us about which masks are most effective and what the differences are.
As we've learned more about what masks are effective, it's really come out that multi-ply synthetic masks offer greater protection. And those are your N95s and your surgical masks that really limit the droplet spread from wearers. Cloth masks and other gaiters and bandanas are less effective depending on what material they're made of. Most notably, fleece masks have not been shown to be as effective as other materials.
So Dr. Cutrell, you're an infectious disease expert, so we're curious, what type of mask are you wearing when you're out and about around town?
I use the same type of, medical surgical mask whenever I'm kind of out and about that I use in the hospital. But for my family, we use kind of a multi-ply, cloth mask that fits tight to the face. I think the key is one that fits to your face well, that you don't have to constantly be touching and adjusting because there's possibility of contamination there. And I think also some of the ones that rest more around the neck, like the gaiters or the bandanas, the knitted masks have been shown to be not as effective at preventing droplet spread.
So Dr. Cutrell, here's a hypothetical for you. So if you're many of us get invited to things now as people are doing a few things more socially. Let's say you show up to someone's house, there's 10 people there and no one's wearing a mask. What would you advise us to do in terms of safe practices?
If you're invited to any situation and you show up, maybe it's a restaurant, maybe it's a social gathering, and you feel uncomfortable, I think that you really need to have the courage to say, to separate yourself from that situation. And the second thing I would say is, if let's say you're planning a social gathering, you're hosting an event, first you should ask yourself, is this something that could be done virtually, or do I feel like it needs to happen in person? If the answer is yes, then think about where's the environment where we're going to be hosting this. Could we do it potentially outdoors? I know it's very hot in Texas, but is there an outdoor venue where people can be spaced? So I think if you're planning it, you want to be proactive about that. But if you find yourself in a situation where you don't feel safe, I think you should have no qualms or hesitation about, removing yourself from that situation.
So Dr. Toomay is our Chief Medical Officer for our health system here at UT Southwestern. I know you're thinking about the flu season and how we might do things differently. Tell us a little bit about how we should be thinking about the flu season with COVID-19 in the background.
Just like any other year, it's important to get your flu vaccine early this year and protect yourself against flu. But the other thing that's starting to come to light is that the non-pharmacological interventions that we're all practicing, basically masking, social distancing, and increased hand hygiene, works against really any infectious disease. And so the practices that we're taking to stop spread of COVID will also work towards the flu as well.
So Dr. Cutrell, we've been wearing masks for a long time now. So we're going to anticipate that we'll be wearing a mask until a vaccine becomes available, or perhaps even afterwards. What do you think it will take for us to get to a point where we won't have to wear a mask again?
Even before COVID, there were some countries where wearing a mask in public was pretty routine, during respiratory viral season. And so we may be in a situation like that. But I think until we identify an effective vaccine, as well as until we're in a situation with testing where we have widespread rapid testing that's able to identify cases quickly, and with those two measures in place, then being able to reduce community transmission, I think that we're looking at wearing masks in public for the foreseeable future.
Dr. Cutrell, I know we've talked about this on this program before about vaccines and where we were in the development a few months ago. Can you update us a little bit about what you're thinking about as the vaccines are in clinical trials now and what you expect we'll see?
The WHO tracks, and there's fully 29 vaccines that are currently in some form phase of human clinical trials, and that would include 6 that are in the late stage kind of phase 3 trials. These are the large trials that really establish whether enough a vaccine is safe and effective enough for licensing. And we're fortunate that here at UT Southwestern, we're going to be participating in one of those phase 3 trials this fall. And so I'm hopeful that maybe by the beginning of 2021, we will have a vaccine that's been licensed, but we'll have to wait for the studies to see which one is going to be effective.
So both of you have children. I'm sure you're thinking about what the school year is going to look like. Tell us a little bit, we'll start with you, Dr. Toomay, about how you're thinking about the school year and what you're talking to your kids about.
Really, it's about what our own tolerance is and how we think the school can handle it. And history has told us that when you open the schools back up, you can do it safely, but they will encounter infections. And how many infections they encounter is based on how the disease is spreading in the community. And so it's really about weighing your individual situation with how long it's going to be before those infections start to land in the school.
Dr. Cutrell, how about you? What are you talking to parents and to students about?
School opening is obviously going to be a critical kind of inflection point to see how things go in our community. My wife and I are considering that. And, for our sons, we're cautiously considering once the transmission level gets to a point where it's safe, allowing them to go back in person, just because we really feel like for our sons, that's going to be their most effective educational venue.
Dr. Cutrell, what are people asking you about COVID-19 and what questions are you hearing the most?
Yeah, so I get a lot of questions about, what treatments are on the horizon and, what do you think works the best? And, is there anything new that's coming in the pipeline? And certainly that, that has been evolving over time. And there, I think it's really important that we see this not as a sprint, but really as a marathon. I do think we're going to be living with COVID and struggling with some of these challenges for, 6 months at least, maybe longer. And so I think persevering in doing the right things, the things we know that are going to help are critical, rather than, feeling like, oh, if we can just get through the next week or two, then we're going to get back to normal. And so I think having that longer term mindset kind of can help everybody persevere, as a community to keep each other safe.
So we've been learning all along the way about COVID-19, and we want to thank both of you for being here and catching us up on what the latest things are about what to know about COVID-19. So thanks again for joining us.
Thanks for having us.
As the COVID-19 pandemic continues to evolve, we continue to learn. At UT Southwestern, we appreciate the opportunity to share what we've learned with all of you through these episodes. So please tune in again next week, and until then, stay safe and stay healthy.